And I treat all aspects of dermatology, as I'm sure many of you know. I treat skin cancer, I treat rashes, I treat warts, I treat acne, I do Botox injections, the list goes on and on, really the full gamut of dermatology. But there is one topic that I treat that with certainty draws the greatest emotion from the patient, particularly women, and that is hair loss. There is nothing else that I treat that brings on tears the way hair loss does for the women that I consult with. I can treat much more serious problems, but the effects of hair loss can be very dramatic. For men as well, there's no men here tonight, but for men as well, although it can somehow be somewhat more socially acceptable for some men. There are lots of men who have the same kinds of emotions, and I have treated 18-year-old men who are young men who are starting to lose their hair, and it can be very emotional. And hair loss, again, for women is that topic that is can be very traumatic. It's a difficult topic. It's a lengthy consultation, and the reason is that it's not one thing. There are many different causes for hair loss, and of all the topics that I consult with people on, it requires the greatest amount of time to try to sift through what's going on. So hair loss is not hair loss. It's not the same for everyone. There are many different causes of hair loss. There are different patterns of hair loss, and my job is to always try to dissect through that and figure out what's going on for that individual and see what we can do to help. And the causes can include underlying medical problems. They can include causes related to medications that people are taking. There's lots of them that cause hair loss. It can be due to certain kinds of rashes or underlying skin conditions that people can have that can cause hair loss. And it can be due to all the stuff that women do to their hair to try to make their hair look good. Actually, that's the most common cause of hair loss, breakage from all this stuff that women do to make their hair look the way they want it to look. People have probably heard the term alopecia. People come in and say, I have alopecia, or my friend has alopecia. The word alopecia just is our fancy word in dermatology for hair loss. So it doesn't really say anything other than there's hair loss going on. There is another kind of hair loss called alopecia areata, where people lose generally circles of hair on their scalp or eyelashes or eyebrows, or sometimes the whole scalp or body hair as well. And that's a different, unique cause of hair loss. So it's a very complex subject, and because of that also, I probably am not going to be able to get to the individual tonight because I need to do a full consultation to figure out what's going on. And then importantly for tonight's topic, if you as an individual might be a candidate for PRP. Okay? So what is PRP and what is PRP used for? The other form of hair loss that I really didn't mention on my list is another common form, which is from aging, from hormonal changes. Women lose hair the same way men lose hair. Women, their hair gets thinner as they get older. It It's the natural course of things, just like it is for every man. It tends to concentrate here in the front of the scalp, the temples, and the crown, just like it would for a man. But women have estrogen on board throughout their lives, so it would be exceedingly rare for a woman to thin to the degree that a man would thin. So we call the way that men lose hair male pattern baldness, or male pattern alopecia, or androgenetic alopecia, and that same pattern can occur with women. It's referred to as female pattern hair loss, female pattern alopecia. And again, those same areas that you see in men, the front, the crown, and the temples tend to be involved. And that process occurs as part of the aging process, from hormonal changes, loss of estrogen as women age, and genetics can play a strong role in that. It's always said that it's a bit more predictable from the females, the mother side of the family, how a woman or a man is going to lose their hair. So if your mother's side is very thin, particularly from a young age, that's a little more predictive than the father's side of the family, although both sides can have an influence. Okay. So PRP, the main indication is for that category of hair loss. Female pattern hair loss or male pattern hair loss, although it can be used for other types of hair loss as well with some success. When someone comes in for a consultation, we need to again decide what's the cause of the hair loss, figure out what's treatable based on that cause of hair loss, and then move forward with that. For male pattern hair loss and female pattern hair loss, the options are very limited. There are topical medications. The one that's been studied most extensively is Rogaine, which is topical minoxidil. It's been around for years. It first came on the scene more than 15 years ago, and it came on as a prescription product, so it really went through some pretty rigorous testing. It comes in 2 strengths, and it's a topical medicine that you apply indefinitely, twice a day on your scalp. There are some other topicals that are used to help add volume, slow the hair loss. One of them, we have a system called Trichomen, which we have a raffle. You all filled out the raffle papers, I hope. So somebody's going to get that little kit, and it's a really nice product system. The other thing that can be used for hair loss is Propecia, which is a pill that's really used for men, and it can help to regrow hair. It can help to slow down the hair loss, and again, it's a pill, and you take that pill indefinitely. That pill is also used for an enlarged prostate for men, and there are some side effects with it, potential side effects, so not every man wants to take that, but it's an option, not an option for women. The other option is hair transplants, where hair is taken from the back of the scalp, where people have, in general, more dense follicles, and that hair, the follicles are individually transported to the front of the scalp, one by one, and that's another option. It's a surgical option, and that's an option, and it has a good role if you've got a good donor site back here, if you're a surgical candidate, and it's something you have to keep after because the rest of your hair you continue to thin and lose. And that's it. That's it. Before this, that's it. That's the whole story for hair loss. One of the most common causes of hair loss, that most women will experience throughout their life, at some point in their life. So anything that's new on the scene to treat hair loss is very exciting, particularly because the options are so limited. So we'll move forward to PRP. Okay. So has anyone heard of PRP? Has something heard of it? You've heard of it? In dermatology for hair loss, have people heard of it elsewhere? So PRP stands for platelet-rich plasma. The plasma is one segment of your blood, and the platelets are your clotting cells. They're the cells in your bloodstream that help you to coagulate, that help you to clot. Okay. So PRP refers to the part of the plasma of your blood that is rich in platelets, that has a high density of platelets. Okay, PRP, it's started to be used in dermatology for hair restoration. It first came on the scene in orthopedics, used for healing of joints, wound healing, tendon injuries, to stimulate growth, and it has some good success throughout the orthopedics world. It's also used in other specialties, in pain management. It's used for wound healing. It has a role in dentistry, and then throughout the aesthetics world. It's started to be used for sexual dysfunction, enhancing sexual function. So it can be injected vaginally, and that's something actually new and exciting. Welcome. Come on in.
What do you mean dysfunction?
I just started talking about PRP and just was discussing hair loss, and we're talking about all of that again. I just keep going. So that's an exciting new area that we're looking into to also add to the practice. So who's using PRP? Lots of people. There's lots of well-known athletes who've acknowledged using PRP, and today many professional sports teams' training rooms contain a centrifuge, which is the instrument that we use to obtain that PRP. Tiger Woods, one of the football players before the Super Bowl, Alex Rodriguez, and on, baseball, football, and other sports. So it's gaining a lot of notoriety when some of these celebrities are using it. Okay. It is a natural process. It's injected into you, but it's you that's being injected. There's no foreign bodies. There's nothing for you to be allergic to. I don't like the word natural. I don't know if anyone's heard me say that, but I'm not so big in the natural as a word, because poison ivy is natural too, but you wouldn't want to rub that all over yourself. So everything natural is not necessarily a good thing. But this is you. This is injecting you into you. So it truly is natural. So side effects really are minimal. This is just showing you just a diagram of a platelet, your clotting cell, and it's filled with lots of materials that get activated and released upon injection. It's filled with growth factors, It helps to initiate clotting, and it's got a lot of activity in this one little cell. Okay. Platelets release growth factors, which start a healing and clotting cascade for wound healing. And these are some of those growth factors that have a number of different roles, including stimulating collagen, stimulating the top cells of the skin, the epidermal cells, and stimulating blood vessels to grow and be activated. And this is just a schematic of the healing cascade and how platelets help ultimately to regenerate tissue. You can just skip that one. This is just about the clots, the clotting. So the system that we use to obtain the PRP is called the Eclipse system, and I've chosen that system because it gives the highest platelet yield of any of the other systems. So we want the most highly concentrated amount of your platelets to inject into you. And that's how this system enables that. Okay. The other advantages are with this system, we have to draw the least amount of blood from you, and there's the least amount of the cells that might initiate bruising and more burning sensation when the PRP is injected. So the process, what happens with PRP is you come into the office, we draw your blood, just like if you went to any lab and had your blood drawn. We take your blood, we put it in a centrifuge, which is a spinning device, and we spin it at a high speed, and the platelets are heavier and they get concentrated at the bottom of the tube. And we then take off the low platelet part of the blood, and we're left with your plasma filled with a dense concentration of platelets. And that's what we're going to use for the treatment. A little technical difficulties. Okay. And then what happens is I take that material and I inject it into the scalp. And it's injected wherever you have the hair loss. So if it's just in the front, if it's just on the part, if it's just in the temples, if it's the whole top of the scalp, and I distribute that through the whole area that's involved. We apply a topical anesthetic before doing the injections, and we have a cooling device that we use all to make this as comfortable as possible. People always ask, is it going to hurt? Everyone of course wants to know, is it going to hurt? Everyone's different, and it's a question that I always have a hard time answering because everybody's got a different threshold for pain. Some people I do procedures on, and they ask me, have I started yet? And I'm halfway through, and other people, it's much more dramatic, and everyone is different. We try to do everything we can to make it comfortable, reasonably comfortable. The needle is fairly small, that's injected. You have the topical anesthetic on board, and we have the cooling device. It burns a bit when it's going in, and it stings a little bit for a short time afterwards. But it doesn't take very long, about 10 minutes to do the injections, so this is not a lengthy procedure. And then, say again? Yeah, you can just keep that there. The treatment protocol that I'm following in the office, which is how I was trained, is that people come in once a month for 4 months, and then come in every 4 months thereafter to maintain their hopefully great results. Hair can be stimulated to grow where you see improvement typically after the second treatment. But everyone is different. There are some people it may take 3 or 4 or even up to 6 treatments to get results. The process for the injections is the same each time, and we would focus on, again, where that problem is. There's lots of studies that have been done, more and more that are coming out, looking at the results of PRP for hair loss. It doesn't work for everybody, but neither does Rogaine, neither does Propecia, neither does any one thing for hair loss. But the success rate is very nice, and more studies are being done. There are very few dermatologists who are doing this treatment. We're one of the first practices in Connecticut. I was trained by someone in New Jersey who has done, how many people?
Dr. Jeffrey Rappaport, real quick, my name's Dan Gibbons, I'm with Eclipse. That's okay. So Dr. Rappaport is who Dr. Evans trained under, or trained with I should say, and he does about 10 of these a day now, and about 16 months ago he read 4 of the key pivotal studies that came, they're international studies that came from South America and Brazil, and Portugal and Spain, and in 16 months he went from not doing this at all to doing the most in the whole country. So Dr. Evans is correct when she says that she's trained under and with the leading doctor who was actually with our system with Good Morning America about 4 or 5 months ago. He did a couple of the executive producers with the high concentration system that Dr. Evans has. And he's gone from doing none, like I said, 16 months ago, to doing about 10 a day.
And I'm following his protocol. Every study I read, there's another protocol. This is not, it's not set. It's still in development. It's all the specifics about what is the best way. Nobody knows yet, but it's very exciting, and I'm following his protocol because he's seen such great results. So these are just some studies showing improvement, and in most of the studies, the majority of patients are seeing improvement. They're seeing growth, they're seeing increased volume, and they're seeing good results. And these are just some before and after photos that you can see. This is someone, a man who was injected, and this was 2 months after having 1 treatment. This is another patient 2.5 months after their first treatment. Another man 8 weeks after his series of treatments. Another patient 4 months after 1 treatment. And this is another patient with pretty significant improvement after their treatments. And here's a female injected. This is 7 treatments, and her hair loss is more in the part line and a little bit beyond the part line.